No, Prime Minister, I am coming to you for the statement. Prime Minister.
Mr. Speaker, with your permission, I'll make a statement on the Omicron variant and our measures to contain this virus, fortify our NHS and keep our country open. First, I'm sure the whole House will join me in paying tribute to everyone working in our NHS and social care for their extraordinary efforts in the teeth of yet another wave of this pandemic, and for all they've done together with thousands of volunteers to get Britain boosted. Since we began the Get Boosted Now campaign just over 3 weeks ago, we've delivered 10 million extra boosters across the UK. We've doubled the rate of vaccination from 450,000 doses a day to a peak of more than 900,000. We've matched the NHS's previous record day and then beaten it again and again. And we've met our target of offering a booster to every eligible adult in England a whole month early. As a result, we have a higher level of booster protection than all our European neighbours, with over 34 million boosters administered across the UK, including in England, reaching more than 90% of the over 70s and 86% of the over 50s. Together with the evidence that Omicron causes less severe disease than previous variants and the way the public have conscientiously changed their behaviour in response to Plan B, this level of protection means we're in a very different position than during previous waves. I know some honourable members might therefore ask whether this means we can now do away with measures altogether, but I'm sorry to report that hospital admissions are rising rapidly, doubling around every 9 days, with already more than 15,000 COVID patients in hospital in England alone. We're experiencing the fastest growth in COVID cases we've ever known, with over 218,000 cases reported yesterday, although that included some delayed reporting. And potentially of greatest concern, case rates are now rising rapidly among the older and more vulnerable, including doubling every week among those over 60, with the obvious risk that this will continue to increase the pressures on our NHS. So, in response to the latest data, the Cabinet agreed this morning that we should stick with Plan B for another 3 weeks, with a further review before the regulations expire on the 26th of January. People in England should carry on working from home whenever they can, wear face coverings on public transport and in most indoor public places, and take a test before going to high-risk venues or meeting the elderly or vulnerable. All of these measures are helping to take the edge off the Omicron wave, slow the spread of infection, manage the immediate pressures on our NHS, and buy time for the boosters to take effect. And those in Scotland, Wales and Northern Ireland should, of course, continue to follow the rules where they live. Mr. Speaker, faced with these pressures on our NHS, I know some members may ask the opposite question, whether we should go even further and move towards a full lockdown. But lockdowns are not cost-free. They impose a devastating toll on our physical and mental well-being, on our businesses, jobs and livelihoods, and worst of all, on the life chances of our children. So this government does not believe we need to shut down our country again. Instead, we are taking a balanced approach, using the protection of the boosters and the Plan B measures to reduce the spread of the virus, while acting to strengthen our NHS, protect critical national services and keep our supply chains open. We're building on-site Nightingale hospitals and creating 2,500 virtual beds to increase NHS capacity. We've bought more antivirals per person than anywhere else in Europe, and we're now working to identify those trusts which are most likely to need military support, so this can be prepared now. From the 10th of January, we will provide 100,000 critical workers in England with free lateral flow tests for every working day to help keep essential services running. This includes those who work on critical national infrastructure, national security, transport and food distribution and processing. And these tests are separate and in addition to those already allocated to our public services, such as in education, where we have delivered 31 million testing kits to schools and colleges for the start of the new term. Mr. Speaker, we have the biggest testing programme in Europe, registering almost twice as many tests as France and 4 times as many as Germany. Last month alone, we distributed 300 million lateral flow devices, enabling millions of people to get tested and keep their loved ones, friends and colleagues safe in the run-up to Christmas. But thanks to the sheer size of the Omicron wave, we still need to take steps to ensure our testing capacity reaches those who need it most. So we will be suspending the need to do a PCR to confirm the result of a positive lateral flow test. From next Tuesday in England, if you test positive on a lateral flow device, you should just record that result on gov.uk and begin self-isolating. Mr. Speaker, our balanced approach also means that where specific measures are no longer serving their purpose, they will be dropped. So when the Omicron variant was first identified, we rightly introduced travel restrictions to slow its arrival in our country. But now Omicron is so prevalent, these measures are having limited impact on the growth in cases while continuing to pose significant costs to our travel industry. So I can announce that in England from 4 a.m. on Friday, we will be scrapping the pre-departure test, which discourages many from travelling for fear of being trapped overseas and incurring significant extra expense. We will also be lifting the requirement to self-isolate on arrival until receipt of a negative PCR, returning instead to the system we had in October last year, where those arriving in England will need to take a lateral flow test no later than the end of day 2, and if positive, a further PCR test to help us identify any new variants at the border. Mr. Speaker, all these measures are balanced and proportionate ways of ensuring we can live with COVID without letting our guard down. And we can only do this thanks to the biggest and fastest booster campaign in Europe. Yet, Mr. Speaker, there are still almost 9 million people eligible who have not had their booster. As many as 90% of those in intensive care with COVID have not had their booster, and over 60% in intensive care have not had any with COVID, have not had any vaccination at all. And there are 2 million slots available in the next week alone. So I urge honourable members on all sides of the House to do everything possible to encourage your constituents to get boosted now. This is the very best way to save lives, reduce pressure on our NHS and keep our country open, and I commend this statement to the House.
Deputy Leader of the Opposition.
Thank you, Mr. Speaker, and can I thank the Prime Minister for advance sight of his statement, and can I wholeheartedly back him in asking people to come forward to get their booster jabs and to get their jabs. And of course it's right that Plan B measures must stay in place during this wave of the pandemic. It was the Labour Party who made sure the government had the votes to pass these measures through this House. And if it wasn't for Labour's actions, the NHS would be facing even greater pressures. And the likelihood is we would have needed much harsher restrictions. And my message to the Prime Minister today is, despite the people sat behind him and those eyeing up his job alongside him, Labour will always act in the national interest and put the public health before party politics. Now, the Prime Minister has said we have to ride out this Omicron wave, but the NHS isn't surfing. It's struggling to stay afloat. We've now seen several hospital trusts declare critical incidents, meaning they are unable to provide services for cancer and heart disease patients. In my home of Greater Manchester, non-urgent surgery is being halted. I thank those trusts who have come forward and been upfront about the reality that they are facing, and our NHS staff who are going above and beyond once again to get us through this period. Isn't it time for the Prime Minister to be straight with people and give a frank assessment of the state of our NHS? He mentions the use of the army, but how many trusts have declared a critical incident, and what does the Prime Minister plan to do about it? People in the North East are being told to call a cab or phone a friend if they are suffering a suspected heart attack or stroke. That's shocking, Mr. Speaker. But even before Omicron hit, thousands of suspected heart attack and stroke victims in England were forced to wait over 1 hour and 40 minutes for their ambulance. Isn't the truth that our health service went into this wave of infections with the largest waiting lists on record, the longest waiting times on record, and major staff shortages? After a decade of Tory mismanagement, the NHS wasn't prepared for COVID and didn't have the spare capacity to cope with Omicron. It's not just that the Conservatives didn't fix the roof when the sun was shining, they dismantled the roof and removed the floorboards. Now, Mr. Speaker, Getting testing right remains the best way to avoid further restrictions. It's welcome that the government is requiring daily testing to protect critical national infrastructure, but this won't begin until next week, and our essential services are buckling under the pressure right now. Doctors, nurses, carers, teachers and pupils can't get the tests they need now to do 2 tests a week. Emergency workers are reportedly stuck in isolation because they can't get their hands on a test. So why did the Health Secretary claim on the 13th of December that there is no shortage of actual tests? Why was the government's delivery service allowed to go on holiday over Christmas with no contingency plan in place? The government has been asleep at the wheel, Mr. Speaker, and the result is total shambles. I'm sure the Prime Minister will join me in thanking the Welsh Labour government for sharing 4 million tests with England. Thank goodness they had the foresight to plan ahead and secure enough tests for this period. Mr. Speaker, in April 2020, the government published a strategy to scale up COVID-19 testing programmes. They promised to work with the UK's world's leading diagnostic companies to build a British diagnostics industry at scale. Yet 2 years on, this has never materialised. How much taxpayers' money was spent on this programme? And why, Prime Minister, 2 years into the pandemic, are we still reliant on tests from China instead of building the capacity to make the tests here in Britain?
Why are you buying abroad? Make them at home.
Mr. Speaker, he can shudder away, but he'll have his opportunity in a minute. People will be returning to work this week, but the government is refusing to guarantee all workers sufficient sick pay, leaving working people with the choice of going to work to feed their families or staying at home to protect public health. Will the Prime Minister finally raise sick pay so that people are no longer faced with an impossible choice of doing the right thing or feeding their family? And Mr. Speaker, in some of the poorest countries in the world, less than 10% of the population are vaccinated. This is shameful. We know we can do more to assist the international vaccine efforts. And what is the government doing about this? And if we are going to break this endless cycle of new variants, we have to vaccinate the world. This is not just a question of doing the right thing for others, it's in our national interest too. Finally, Mr. Speaker, there are Conservative members sat behind the Prime Minister who have spent recent weeks attacking hard-working public servants. Isn't it time that the Prime Minister stood by our experts, professionals and officials that are doing all they can to protect public health? If he was happy to defend Dominic Cummings, the former Health Secretary, and Owen Paterson, why won't he defend those public servants who are actually doing the right thing?
Well, Mr. Speaker, when it comes to attacking hard-working public servants, why does she continue to attack our testing operation, for instance, Mr. Speaker, which has done a fantastic job throughout this pandemic? And see, there were several things in that intervention, Mr. Speaker, which was simply completely the inverse of the truth. We are not cutting cancer services, Mr. Speaker. We've invested more in oncologists. We've got 4% more oncologists this year than last year, 5% more radiologists. And she asked about ambulances. And yes, of course, everybody should get an ambulance who needs one. That's why we've invested 55 million more in the ambulance service. There are 500 more ambulance staff now than there were in 2018, Mr. Speaker. 10,000 more nurses, 5,000 more doctors than there were last year. And that is because the investment that we are making, £36 billion, every penny piece of which they voted against, Mr. Speaker. To come to testing, I mean, it really is extraordinary that they run down this country and its achievements time and time again. Look, Mr. Speaker, we're doing 520,000 PCR tests every day, 1.25 million tests every day. We've tested 400 million, done 400 million tests in the country. More tests per head in this country than any other European country. She talks about schools. We delivered 31 million tests to schools in the run-up to Christmas. And she made an incredible point, Mr. Speaker. She said that this country didn't have its own diagnostics capabilities. She doesn't know what this country is doing. Unbelievable. We have let me tell the opposition front bench. We have the largest lateral flow manufacturing company facility in this country. Go and visit it, Mr. Speaker. They don't know what they're talking about. It's in Nottingham, Mr. Speaker, and we buy them all. And by the way, she talks about the testing regime. It's thanks to the efficiency of our testing regime that the leader of the opposition, whom we wish well, is not currently in his place. It's thanks to the testing regime, Mr. Speaker. She's able to speak from that dispatch box at all. So she might as well support it, Mr. Speaker. They've done an incredible job. Two final points, Mr. Speaker. They voted continually against our funding for the NHS that has made this possible, and let's be in no doubt, they would have kept this country in lockdown from July the 19th. They were opposing, and members of the front bench chorused that we needed tougher restrictions as we came into Omicron, and they said we needed a roadmap for lockdown. That was their approach. And what would have been the result, Mr. Speaker? Another body blow to the UK economy and to our ability to fund our NHS. And that is the fundamental difference between this government and that opposition. We have a plan for getting through COVID. All they do is carp from the sidelines.
Theresa May.
Thank you, Mr. Speaker. May I commend